Okay, hello friends. Good evening, everyone. Hello. All right, so we are still waiting for Prof to come in. We will start at 9 p.m. exactly. So while we are waiting, you can scan the QR code, and for UM medical students, this is the subscription for MEDSOC's email. You get regular updates and also newsletter from us. And also for non-UM students, it's possible for you to subscribe, but you only get updates for our future events. And also, if there's any question, if there's any questions later in the session you want to ask Prof, you can just leave your questions in the comment section. And if you have the time, since you are still waiting for the time, so you can follow our Instagram and also our Facebook. All right, let's wait for 9 o'clock.
Okay.
Hi, Prof.
Can you hear me? Hi, can you hear me?
Yes.
All right. How's the volume? Okay.
Yeah. Okay. From my side, it's okay.
Okay. So I need to adjust my camera a bit. Okay. So my experience medical school offshore, I actually haven't prepared anything.
It's fine, Prof. We just have a casual talk. I'm pretty sure.
Okay, casual talk
Yeah,
medical
it'll
school.
go well.
Okay.
Yeah.
To 1997.
Yeah. So, Prof, allow me to do some advertising for the society first before we start. While we are still waiting
Carry on.
9 o'clock.
Carry
All
on.
right. Okay. All right. So, friends, this is a second episode of a series. This is not a one-off episode. We have a series, and there's more coming. We have had a internal medicine episode not too long ago, and today we have Associate Prof Dr. Faizal with us speaking about neurosurgery. So stay tuned. Stay tuned. We will have more to come. All right. Also, if you are here already and waiting for the live to start, you can scan our QR code and you'll get updates for future events. And also for UM medical students, this is exclusively for you guys, my friends. You get updates and newsletter from the medical society. And if there's any questions that you would like to ask Prof later, just leave your question in the comment section. So if you still have the time, just follow our Instagram and Facebook. All right, let's wait for the time. All right, Prof, shall we start?
Okay. Hello.
All right, okay, so hello. All right, so Prof, let me start the introduction.
Carry on.
Okay, all right. So good evening, everyone. Good evening, friends from UM and from not from UM, everyone. Hope everyone is well in this period. So I'm Chee, I'm a third medical student. So today we are doing a second episode of our Meet the Specialist series. All right, thank to the Education Bureau for the opportunity given to me to host this episode. And together with us, we have Associate Professor Dr. Faizal, our paediatric neurosurgeon in University of Malaya Medical Center, and also our lecturer, and also an alumni of our faculty. So I would like to take the opportunity on behalf of MEDSOC, on behalf of students, to express our gratitude to Prof Faizal for willing to share his experience and perspective. All right, Prof, thank you for being here with us.
My pleasure to be here.
Maybe to start off with a short introduction, because
Okay.
some of the audiences are in first year, second year, they might not have met you before.
Right. Hi everyone. My name is Faizal, and previously I was known as FAB, Faizal Ahmad Bahuri, in the medical school. And then as I become a doctor, I don't want people to call me Fab. It's like, you're just a house officer. Why do you call yourself Fab? So I asked all my friends to call me Dr. Faizal. And subsequently, until 2011, 2015, 16, then we have another Dr. Faizal, orthopedic. So we have cross references, people calling me to do certain orthopedic operation. So I said, maybe it's time to go back to Dr. Fab. Okay, so I am UM alumni. I started medical school in 1997, and I finished in 2002. I enjoy medical school very much. It was one of the best time. And actually, I don't want to be in medicine. For some of you who have heard my podcast before, or maybe some who have attended my class, you probably have heard me saying that I don't want to be a doctor in the first place. My ambition when I was small was I want to be a robotic engineer. I have a passion in computer. I love creating stuff, and I hacked my mom's computer when I was small, and I was banned from using computer for 1 year. And when I was in Form 5, I created a robotic arm, and I won a state championship for robotic. So I said to my mom, this is a good opportunity for me. I have a credential. But my mom says that doctor is probably the best job for me. So I said, okay. So I applied for UC Malaya. I didn't get into medicine. I got into dentistry. I spent 1 month, not even 1 month, 1 week of orientation in dentistry. Yeah. And during the first week of orientation, you get to know your seniors, you get to salute and do all sorts of crazy stuff. For those who are in UM, you probably know this. There's no physical abuse, but it's just a matter of getting to know people, and in a weird way. Then I bought all my books, dentistry books, and then after 1 week, I received a phone call and asking me, there's a potential space in medical faculty. Do you want to join? I said, sure, why not? That is what my mom want me to be. So I said, okay. And I sold all my dentistry book to my to my dental friends. And I got another week of knowing your seniors in 6th college. I said, oh my God, what an unlucky stuff that I did. So yeah, it was a wonderful years in medical school. First year, second year. I told myself, if I can pull out the first year, I joined second year. And to me, it's like, okay, I can do first year, I can do second year, and then I can do third year. And then I realized that probably this is too deep for me. I said, let's finish this off and see what happened. So on my final year, in my final years, I've decided that I want to be a surgeon. I want to be an orthopedic surgeon, because it's like robotic kind of stuff, fixing few things, and I love the handiwork. So I told myself I'll be an orthopedic surgeon in 2002. Then come housemanship. I asked to be posted in the northern region. I got Seberang Jaya, Hospital Seberang Jaya, for those who are in Penang, or who the hospital is just right next to the highway. And this is a nice place to be, near Butterworth. I got posted there for 1 year. I hated orthopedics. I had orthopedics for 3 months and I said, no way, I'm not going to do orthopedics. It's a lot of fun, it's hard work, but it is not for me. So I decided maybe I should be a surgeon. So at that particular time, in 2002, 2003, there's a popular TV shows on Discovery about trauma surgery. And I said, oh, maybe trauma surgery is the best place to be. So I applied for lecturer trainee post in University Malaya, and on the ticket of being a trauma surgeon. Okay, after I finish general surgery, I will be pursuing trauma surgery as my career pathway. So during these training years, Master of Surgery in 2004, 2005, 2006, I like surgery. I love how I can change patients' life from severely ill to and make them better by doing surgery. And I know how I can I learned how to operate my hands with hand-eye coordination. I love that things, but I received negative feedback from my potential mentors. One trauma surgeon in US asked me simple question like, how many gunshot wound have I seen in Malaysia? I said 0. I said, how many people got stabbed on the road in Malaysia? I said, I haven't seen any. And he said, he can train me to be a trauma surgeon, but I wouldn't have any job in Malaysia because Malaysia is such a peaceful country. So that is the turning point of my career. It was on 3rd year of general surgery. Why would I want to spend my time overseas and come back and serve no purpose in a peaceful country? So at that particular time, Professor Vicky approached me and he asked whether I want to join neurosurgery because it has some trauma in it, and maybe I can try it. So I committed to it. So on my 3rd year, I say yes, I will be joining neurosurgery right after I finish my general surgery practice. So that is how I get into neurosurgery. So in some cases, you choose your career, but most of the time, if you will realize soon that the career finds you. So neurosurgery found me rather than I found neurosurgery. Okay, and I joined neurosurgery. It looks interesting, and I enjoy the busyness of neurosurgery. It's really busy. Okay, I spent 2 years with Prof Faizal. So he is my senior by 1 year. So we spent 2 years, 15 calls in a month for 2 years. So if I'm not on call today, I know Prof Faizal will be on call the next day. So all the jobs is like, I know either he will do it or I will do it. So that's how we forge our friendship. So he's one of my best colleagues in the Department of Surgery because we spend, I mean, almost every other day in the hospital doing certain things. So Master of Surgery is 4 years. And then I further my study. I did a PhD in Oxford University in 2010. So again, the university chooses me rather than I choose the university. This is another interesting story because I was primed to go to Sydney University in Australia. However, during the last 8 months of my training, I met a professor professor of Oxford. So I asked him, is there a possibility for me to do training in neurosurgery in Oxford? And he said, why not? So I sent a proposal and got accepted. And I told the university management that there's a chance for us to affiliate with Oxford University, which is higher ranking than us, than Sydney University. So that is how I get into Oxford University. That was the best time in my academic career, because that is where I reflect back on the physiology. For those first year who study respiratory physiology, if you heard of Haldane, if you heard of what else, the gas law, if you heard of Marie Curie, all of these people all were in Oxford, and there's a building which I was assigned to called the physiology department. This is where they did all the physiological tests for respiratory, and those names that you read on the textbook, you pass through the labs, and it's like, wow, this is how they detected PaCO2. They detected acid sensors in the brain, and yeah. So if you have the opportunity, even if to visit, I would suggest go and visit Oxford University. Go and have a look at their libraries. Go have a look at the Harry Potter's. I would say Harry Potter's location. Yeah, so it was interesting, and
Okay.
yeah, right. So that is how I get into neurosurgery. I came back. With a thesis on how to control respiratory, what is the effect of voluntary breathing to our brain. Yeah, so that is what my thesis is all about. So I know how we can control our stress level. I know how to control our breathing and what is its effect to our brain. That is my thesis. And I came back. There are about 8 neurosurgeons, including me. So we have to define our work. So there's an opening. Prof Damendra is the only person doing pediatric neurosurgery. So I said I can be his second in line. So that's how I get into pediatric neurosurgery. So pediatric neurosurgery is another busy place to be, where
Prof,
yes,
Prof, is it okay if we talk about the context of neurosurgery and more about that? And for
sure.
now, a question from the audience, I think is relevant from what you have shared with us just now. So there's this one of our friends asking, what made you choose surgical field? What made you so sure that you want something to do with surgery and not internal medicine?
Okay,
I just felt that it's relevant, and it's good for us to,
It's more of your personality, I would say. Some of you like to be in control of your situation. I like to be in control of my situation, so I choose surgery because you can control almost everything. Whatever happens is the complication of surgery. Okay, and that with that control, you have to be present in every situation. You have to be in OT. You have to control your situation. You have to be in post-op rounds to control after the operation. So in essence, one operation will require 3 days for one patient.
Right.
So you have to prepare the patient, do the surgery, and take care of them after that. Okay, and for some patient, yeah. So for it, that's why I choose medicine. For some of you who thinks that there is too much, you want to do something simpler, you can choose internal medicine. You can choose, if you like lab-based, you can choose pathology, hematology, and so on. So if you are more like a not so if you're introvert and you don't like to interact with patients or people, there's plenty of job in medicine to do. You can choose lab. You can still operate on dead people. You choose pathology. You can choose a small holes, maybe the nose, ear canal. You can do almost everything. So
there's a space, there's a place for everyone.
Yes, there's definitely a space for everyone, and you can tailor this to your preference. Take for example, if you if you love seeing people, if you love talking to people, take psychology, take psychiatry. If you love to travel, make change in people's life, take SPM, social preventive medicine, because you change people's life. So, and I told myself, surgery, I can only heal one patient at a time, because that is my art. But for other field, they can save 1,000 people at one time. If you do one anti-smoking campaign, you can save 1,000 of people at one time. If you do an anti-suicide campaign, you can save thousands of people in one go. But in surgery, it's one patient at a time.
One at a time.
Yes.
Yeah, but we cannot deny. Even though it's one at a time, it might seem small compared to those public health experts, but it's still needed. We still need surgeons, right?
Yeah.
So, Prof, we move on because we move on to the next part. We would like to explore a bit more about your expertise, which is neurosurgery. So, can you just briefly share to us what does a neurosurgeon do on a day-to-day basis? Yeah.
All right. I was told by my mentor, Professor Vicky, the best definition of neurosurgery is in Bahasa Malaysia, which is bedah otak dan saraf. So you take care of the otak and you take care of the saraf. So that is the real definition of neurosurgeon. So the brain and the spinal cord, as well as the peripheral nerves. So in all domains. So you can, within this neurosurgery, there are many other compartments. Like for example, if you have seen the the pediatrics and the adults. Okay. There's also a vascular neurosurgeon who just do vascular. You can do epilepsy surgery only, or you can do deep brain stimulation only. So it is a field in a field. So you can choose a lot of stuff. So basically you can jaga the spine, you can take care of the spine, maybe the spine itself, because the spinal cord disease, maybe because of the tumors, because of the infection and so on. So again, this is one of the demanding job, because you need to invest your time to make sure that the patient is well enough to go for surgery. Make sure that you have the strategy to cut and you have the strategy to exit, and make sure that the patient is alive after surgery and go back home well. You don't want the patient to go back with neurological deficit. Okay, so it is
All right.
big responsibility. So so one patient, 3 days preparation. So 1 to 3. Okay.
So it's not just the technical part that comes into play. It also needs some. Well, that's where I think the knowledge, everything comes in, and there's
Yes.
also the plan, the strategizing phase
Yes.
of becoming a neurosurgeon. Prof, just now you mentioned a few subspecialties in neurosurgery. You mentioned there's this deep brain stimulation, there's some neurovascular. It's also part of the subspecialties that
Yeah.
it's available in the big neurosurgery field. So is
Yes.
there any other subspecialty that you haven't mentioned yet? And
Okay.
is there any certain subspecialty that is seriously in demand in our country?
Okay. So I mentioned vascular. I mentioned epilepsy, pediatrics. There's also a specialty for tumors alone, and then for base of skull surgery, spine surgery, pain management, and probably a radio surgery. Yeah. Okay. So at this point of time, all such specialty have each has its own demand and obstacle. For example, if I'm doing a pediatrics, I'm dependent on my pediatrics colleague whether they can provide me with support or not. And for radio surgery, the hospital or the institution need to invest on the machine, which costs 20 to 30 million ringgit. So that is limitation. Spine surgery, it has its own limitation because like aging, osteoporosis, and things like that. So as for now, I would say the neurosurgery field is still open. There's only about 110 neurosurgeons in Malaysia, but 30 of these are in 30 of neurosurgeons are in Kuala Lumpur. Yeah. So because this is where the big hospitals are, and this is where people in Kuala Lumpur and Klang Valley is where people earn money. That means that they work here with big corporations, right? As compared to other suburbans. So and then the socioeconomic status is different. That's why the suburbans don't have much of neurosurgical services because the investment is high. In order for us to set up one neurosurgical unit, you need to invest a minimum 5 million ringgit. And what is the return of investment for that 5 million ringgit? How many people can you operate in a day, in a week, in a month? So you need a specialist service like anesthesia, needs nursing care, need ICU. So all the suburban hospital, they don't have this capacity. But again, we have training programs that hopefully will push the government to provide the facilities, because there's no point of having a neurosurgeon when the government cannot provide the working environment. Okay, so we have a Master of Neurosurgery training program in UM, as well as in USM. USM have started this probably 15 to 20 years ago, and we just started it last year. On average, the government wants us to produce about 20 neurosurgeons a year for the country. Okay, and we can, so University Malaya at this point of time can only train 4 or 5 in a year. So another 15 in USM. So these 20 people will serve the government, will serve Kementerian Kesihatan. So we are estimating about 100 people, 100 new neurosurgeon in 5 years' time. So where do we place them? So the government need to plan this in the future, because again, there's no point of training when there's no job for you to do. Yeah. So
All right.
yeah.
So, Prof, thank you for the insight. So,
Mm,
it's a lot of things for us that we don't know about the training pathways, about
mm.
neurosurgery. It's a lot for us to take in. So, actually, what happens after med school? After med school, we graduate, we register with MMC, we do 2 years of houseman, and then
Yep.
2 years of used to be permanent, but now it's contract
Okay.
MO.
Yep.
Yeah, and then how is it like from there? From there onwards, how is it
All
like?
right. So there is no direct pathway to neurosurgery anymore. Sorry, there's no indirect pathway. Like I did a master of surgery before I do such specialty training in neurosurgery. There will be no more such thing like that. If you want to become a neurosurgeon, you must enter master. You must get into the master of neurosurgery program, either with UM or with USM. Okay, so again, you have to compete for 20 spots. So there's a requirement to get into the program. Number one, you must spend 1 year in surgical unit, either in general surgery or ENT or eye, as long as it's a surgical unit. So it is, I would say, acceptable. But if you get into a general surgery unit, it's much better because you know how to open the peritoneum, you know what is the complication of surgery and things like that. Yeah. And then after that, you get into master's program for 4 years. Once you graduate, you need to serve another 2 years for gazettement before you are being accepted into the National Specialist Register. Yeah. So, in general, the earliest you can get into the training program would be 3 years after graduation. Yeah. 2 years housemanship, 1 year of general surgery before you get into the master's program. All right. So that is in general, but
Prof, don't we need to complete the 2 year compulsory service as a MO
yeah.
before we can take on?
So now that comes the interesting answer. So
Okay.
the 2 year compulsory job is mainly for Kementerian Kesihatan candidate. Okay, if you want to get sponsorship from Kementerian Kesihatan, you have to serve them and then you get into the program. Yeah, but if you apply for trainee program with university, with other
USM or UM.
yeah. Training program, as in like maybe UIA wanted to have a trainee in neurosurgery and they have an opening for trainee lecturer, then you can apply to them and hopefully you get selected based on your CVs and they will send their candidate to train with us or with USM. So that's why I said minimum 3 years. Yeah.
I see.
Yeah.
But
So
minimum is 3 years.
yes. So take for example,
Right.
you have graduated and you work as a houseman in University Malaya Medical Center, and then you get a contract job as medical officer in general surgery. Okay, for 1 year. So then you have fulfilled the criteria already to get into the masters of neurosurgery. Now it's a matter of finding who's gonna sponsor you.
So
yeah,
is it the hadiah latihan persekutuan?
something like that. Okay.
All
Yes.
right.
So how do you get? So now it's a matter of finding who's gonna sponsor you into the program. So you can you can join other university as a trainee lecturer and be trained as a neurosurgeon for that particular university. Yeah. So like for example, I did my housemanship here, and then I got selected to become a trainee lecturer in UM to be a general surgeon. Yeah. Okay, so there are plenty of universities, University Sabah, and they probably are interested to open up a neurosurgery unit, but they need a neurosurgeon. So then you apply for a job in that particular university and get trained as a neurosurgeon. So there's plenty of option. You also can finance your own training program. So let's say, for example, now nobody want to sponsor you, and then you said, okay, I take a loan and I want to train to be as a neurosurgeon.
Okay.
You can be an independent trainee. It's just that now, if you take this path, you won't have anybody to employ you, right? So you don't get monthly salary, correct?
While we are undergoing the training.
No, okay. So if you're trained and if you're a Kementerian Kesihatan candidate,
Okay.
You are hired as medical officer and you are sent for training. So they will pay your monthly salary as well as you. The government will pay for your master of neurosurgery. Right. So you get paid to study. Right. If you choose to be independent, who's gonna hire you? So that's the whole issue. You can finance your own training program. It won't cost that much. It's about 40,000 or 50,000 ringgit only. But you need to consider monthly income. Who's gonna pay your monthly income? Okay. I hope you understand what I mean.
Yeah.
Okay.
So it's correct me if I'm wrong, Prof. So the idea is generally there's this master of neurosurgery, but there's a lot of path to get in. You can become either a lecturer, a trainee lecturer, or you can get a KKM sponsored sort of candidate. And if not, the worst case scenario, you can also self-finance.
Yes, you can.
So other than this master of neurosurgery in UM and USM, is there any other, because in other specialties we heard of this parallel pathway thing going on, is it the same for neurosurgery, or UM and USM is the only thing that we can do for now?
So UM and USM, the master of neurosurgery is the only pathway. Okay. There are other unofficial pathway, which is you take the foreign exam but for example FRCS, neurosurgery, but you need to be trained in UK. So you just cannot take the exam and be called as a specialist. So you need to be in the training program before you can take before you can take FRCS. So it means that you will have to migrate out of the country, do training in overseas, and sit for that exam, and then you come back and get registered with the National Registration Board. Yeah. So you can.
Prof, in order for us to do that, we need MRCS or whatever qualifications that foreign country recognize before we can become their doctor and get a training post, right?
Yes. So So it is a long route because you have to compete with other people. Like for example, let's say for example you want to get FRCS. But we don't have any FRCS training here in Malaysia. So the nearest is you have to go to Singapore. You have to be employed by them, work in the system, and then you sit for the exam. And then even after that, you still have to go to UK to sit for the exam. So a lot of investment, a lot of commitment. So you need to commit to that. Yeah. So the easiest way for me that I suggest is take our master of neurosurgery.
local master's program, yeah, in
Yes.
UM or
Yes.
USM. So far, any other university have plans of also establishing the similar program? Any
No,
news or any? Not
no,
yet.
not yet, because we need to know
Not at
that,
the moment.
because now the capacity, what happened after you graduate? Yeah. So Kementerian Kesihatan only wants 20 per year, and then after
Mm.
that you have to work with, you will work in central hospital and so on. Okay.
Mm. All right. So, Prof, do you, for those those in the audience, very interested and passionate about becoming a neurosurgeon, so do you
Yes.
recommend them to take MRCS?
I would say take MRCS. That is the investment, because with MRCS you can get into general surgery if you do, or other surgical based field. Yeah. So it is a ticket to put in your CV, because now remember you have to fight with a lot of other candidates to get into 20 spots. So you not only have to show that you are capable of doing it, you must show that you have some commitment. You said, "Oh, I've done FRC, I've done MRCS, I've wrote some papers with and so on." So the chances for you to get into the program is higher if you have all these credentials.
So
And yes,
it's not like a requirement that everyone must have, but
no,
it's just like the icing on the cake,
yes, it
the
is a
extra
very
icing that
competitive.
we want.
It
Yeah.
is a very competitive field, and you must show that you are in the game. Yeah, tak boleh
All
just
right. All right.
apply je then suddenly minta. And you
Yeah.
please remember, we have a lot of commitment here. Imagine that somebody is giving their head to you for you to operate, and for you to make sure that they go back home with their memory and their function intact. All that you take out is just the tumor. That is a
Mm.
huge demand. That is a huge to ask. So if you really are up for this, high pressure, a lot of commitment, um, and you you like pressure and stressful condition, please, this is your field. This is it.
Okay.
Yeah.
Right. So in short, Prof mentioned that MRCS it's something to add value in our CV, which is important for us to get into a master's program, and it's
Yes.
getting more and more competitive as time goes by.
Yeah.
And also, besides research, what else do they look into? Like, what are the criterias that? What else can we? How can we add value to our CVs and stuff like that to get to increase of the
Yeah.
neurosurgery
Right.
program?
There are a few things here. I have a certain gauge for myself during my training, as well as when I train people. There are three things in life. I mean, during training, knowledge, skill, and ability. Okay, so you must show that you have the knowledge. You must show that you have the skill, and you must show that you have the ability to do it. Okay, so this is the ingredient or the recipe for success. Whatever you do in life, so you must show that you have the knowledge, means that you score in your exams and things like that.
Knowledge.
Yep. Skills. Now you've gone through several training programs like suturings and workshops and things like that. So you
Mm.
show that you have some skills, and you show that you have ability. Means that you are you show the logbook that I've done this a lot, and then you show your commitment, because you are in you. The requirement is first 1 year in general surgery or 1 year in surgical practice. Yeah. So if you show me only 50 cases only in 1 year, it's like once a day, right? Sorry, once a week.
Right.
So how can so where's the ability there? Yeah. Show me the commitment.
Okay,
Yes.
so knowledge, skill, and commitment.
I would say the easiest way is KSA, knowledge, skill, ability.
Ability, all right. Okay.
Yes.
So, Prof, regarding the pathways and all, our friend here, Ruben, he's a fourth year medical student also in UM. So, what are the qualities that the lecturers are looking for when selecting for the trainees we have covered just now?
Yep.
How about universities in selecting their trainee lecturers? Because that is also one of the possible pathway that we can get in the master's program, right? So, what do universities look for in trainee lecturers?
Okay, so basically first we need to know whether there's any opening or not. But I would say other university might have openings because they want to develop their surgical departments. So you must show simple recipe again, KSA, show your knowledge, show your skills, and show your ability. Yeah, so
All right.
Yeah.
So it's essentially the same. It's about how we add value to ourselves and how
Yes.
we ensure that we are competent and capable young doctor lah.
Yes.
So, Prof, there's also a question for this one. We take the opportunity because we are talking about all the pathways and everything now. So, can we also answer Saruvesh that based on what I understand, there's no parallel pathway currently for neurosurgery?
Yep.
Am I
There is
right?
no parallel pathway. There's only one way now, which is Master of Neurosurgery. Because we need to have standards, yeah? Just like driving license. You cannot have a driving license by Negeri Sembilan and then a different driving license test by Selangor and different driving license by different part of the country. You must have one license. Then you know all of them are good or all of them are bad. Okay, so licensing matters.
Okay.
So one parallel pathway, one pathway only.
All right, but Prof, we do see certain subspecialties like CTS is actually having some parallel pathway. Do you think that we will have similar one for neurosurgery soon, or it's not coming?
It won't come. So forget about parallel pathway in neurosurgery. Because the demand is different, yeah.
Understand.
Because again, you have to go back to the prevalence of disease. Okay, there'll be a lot of people who had heart attack need cardiac surgery rather than brain surgery. Yeah, so the prevalence is small. So in order for us to maintain the quality and the training program, so we decided as among the neurosurgeon that we only have one pathway. Yeah, so cardiothoracic team and the association probably have a different idea, and they think that they want more cardiac surgeon in the future, so they have this.
All right, thank you. Another question from Saruvesh: is it possible to do neurosurgery after getting recognition as a general surgeon? But it used to be possible, is it?
It used to be.
Not anymore. Okay.
Not anymore. During the interview, they will ask you if you want to do neurosurgery. You have to request for a Master of Neurosurgery training program. Yeah. So unfortunately, the program has matured. So we have to shut all our doors to parallel because we have to maintain our quality.
I see. Yeah. Okay. So I think we've discussed a lot about the pathway, and essentially it comes down to there's only one pathway. That's the local master's program. available currently in UM and USM, and also
Yes.
there are many pathways where graduates can take to get into the local masters of neurosurgery program. All right,
Yeah.
so Prof, we'd like to know more about neuropathic pain relief, because we know that you are also an expert in this field.
Mm.
So how maybe we appreciate if Prof can let us know generally who needs to have this treatment, or
Okay.
and in terms of skills, who can do it? Is it any neurosurgeon can do this, and how do we
Right.
become trained in that?
Okay. So pain specialty is a new specialty. It is a open field, means that um, whoever who has a master's or a such specialty training can get into pain management. Yeah. So, for example, traditionally anesthetists, uh, they keen to be the pain management specialist. So now neurosurgeon can do that too. Interventional radiologists can do pain management. Even rehab medicine can do pain management. So it's an open field because pain exists in all specialty. So now you have to find at that specialty what is the demand and how can you provide pain control. In UMMC, I work with a group of doctors from rehab medicine, Prof Anwar Suhaimi, who also and then Dr. Shazriman, who is an interventional radiologist, Dr. Lim Siu Min from anesthetist. We have rheumatologists resident who come to us, sports medicine. So you can be a specialist in pain management, because if you take, for example, if you are a sport medicine specialist and you want to treat your athletes, so you need to relieve their pain, because their job is to do sports. They get sponsorships and things like that. They get paid because they are on the field. So as a sports medicine specialist, you can provide pain relief technique to them. So pain management is an open field. And rehab medicine, for example, they're managing older people, even geriatric, who are not fit to go for big surgeries. So you provide pain management service for them.
So how do we become trained in that, Prof?
Okay, first you have to have your subspecialty training. So you have to be a master in either internal medicine. You have to be a master in something.
Okay.
So master of internal medicine, masters of sports medicine, masters of whatever it is.
All right.
Because you are providing pain. Then after that, you have to go for a training program that focuses on pain. So there is no local certificate yet. So you have to go overseas. So there's a few trainings like in Montpellier. There's about 1 year program. You will be trained in pain management. I went to India.
I see.
And I tailored the program just for neurosurgical related pain. So so I was trained in New Delhi for a month. For a month with every day training with my mentor. So in every day we have 5 to 6 cases to do. So when I came back, I'm quite confident to do pain management for my patient. So yes, I do learn how to inject the shoulder, the hip, the knees, but I told my mentor that in Malaysia, it is not acceptable for a neurosurgeon to inject shoulder and the knee. So I said, I will only focus on craniospinal path. So spine and cranial. Yeah.
All right. Thank you, Prof. Because I don't know, for maybe it's just me not seeing things enough, but I feel that it's not very common for us to see a neurosurgeon with pain management, another specialty. So, Prof, another question from one of our friends. So, a fourth year senior medical student. So, asking about work-life balance and the myth of surgeons being super busy.
It is
Is it
super
a
busy.
myth or is it true?
Is it true? It is true. It is super
Okay.
busy. So when you say work-life balance, it's you basically you have to find the right partner lah. Okay, the right partner, the right family to accept you. Okay, because sometimes you get called to do procedures in the middle of the night. So what I've learned along the way was like I never promised my family anything. In terms of, I stopped telling them what time I'll go back. So when I come back home, then it's home. So they are free to go. Let's say, for example, they want to go out for dinner in One Utama. I said, okay, if I able to join them, I'll join them. So that is one thing to achieve work-life balance. You have to find the family who can accept you. You have to find the right partner for that. Yeah. Okay.
All right.
Second, you must organize. Time management is very important. I usually have before every night or on the day before, I will write I'll organize my time. I'll have a certain target. So I kept a diary and I write down what I want to achieve for a day. So like say, for example,
so pre-planning the days before it comes.
Yes, when you pre-planning the day, you need to pre-plan few things. So number one, you need to plan for your personal. Okay, so personal achievement, what do you want to achieve today? Okay, second, what do you want to achieve for your family today? Third, what do you want to achieve for your friends today? And then what do you want to achieve for your career today? So if you can have at least one target a day, then you more or less have achieved the work balance life. So number one, take for example, you want to study computer programming. So that is personal mission, right? I want to learn programming for 1 hour. Okay. For the family, what do you want to tell? I want to make that, I want to send some flower. Okay. And then for friends, I want to call whoever that is in your friend list. Or you want to do a posting or something like that. And career, what do you want to do today? Okay. So I think by having that target, then you have a mission for today. Yeah.
All right. So in a way, it's compartmentalizing.
Yes.
Making something for each part of your life every day and not missing out on the important stuff.
Yes.
All right. Thank you, Prof, for that. Okay. We have another question.
Okay.
Yeah.
When I was in master's program, the first thing that I learned was to juggle ball like in circus you juggle certain things because I want to train my hand-eye coordination. And when I realized I know how to, and when I juggle stuff, I realized that you have to pay attention at two things at one time while one ball is up the air. So that is my personal mission, hand-eye coordination target. So now I can juggle clubs, knives, whatever it is, as long as 3 objects.
Ooh,
I can do it.
Okay.
I do clubs.
Prof,
clubs also.
I think it's good for Prof to also take the opportunity to answer this question because they ask about practical skills, suturing, knot tying, and also some hand-eye coordination.
Yes.
So how was the experience of hard work in refining practical skills until where you are today?
So as I mentioned, my mission during the first year of Master of Surgery is to train my hand-eye coordination. That's why I took up juggling. Yeah, so and so it is an interesting skill because it will make you fail. You will fail, and once you embrace failure, then you can move on. Don't be afraid to fail. That is one of the things. So you train and train and train until you become successful. Nowadays you can practice suturing in unit practice, because this is skills. Yeah, skills is not gift. Skill is practice. Nobody is gifted to know how to suture skin or know how to knot tying. So you need practice and
Practice and practice.
yeah.
Alright.
And
All right, Prof, maybe just before we move on to answer the questions from the audience, maybe before we do that, maybe you can just from your perspective as experience as a neurosurgeon, maybe you can help to give us a more clearer picture so that the future medical graduates can have a informed decision making, because in dramas we see neurosurgeons, they are like god, they can do this, do that. These people come in with some movement disorder and some surgery, looks cool and everything, and then miraculously this patient recovered with full function. So is that the reality of the field? And yeah, just to help us in an informed decision making.
you will not become Doctor Strange. Okay, you will not become Doctor Strange with some mythical power. You will not become Dr. Gray. Yeah. So it is all myth. It's all hard work. You need to sacrifice a lot of time. You need to sacrifice your time with family. You need to sacrifice your time with your friends and things like that. So yes, you can treat people. You can make the Parkinson disease from the tremor to become stable with certain surgery, which is deep brain stimulation. Yes, you can do that, but it comes with training. It's a precise targeting in the brain. In order for you to do that, you have to endure 4 to 7 years of training. It's I would say, Professor Vicky told me there are 2 people who can do neurosurgery. Number one, when he sees the brain and the nerve, he got excited and said, wow, this is cool, I want to do this. Second is a person who wants to be a neurosurgeon, then he can be a neurosurgeon. Okay, so if you already have some idea like I want to be a neurosurgeon, then focus and spend some time in the unit and see whether is this really what you want to do. Because once you become neurosurgeon, it's going to be a lifetime journey.
Okay, Prof, so this is a question also our seniors from UM asking, what's the difference between peds and adult neurosurgery, and why did you choose peds?
Okay.
Yeah.
It is simple. Pediatrics are not small adults. And so why do we have pediatric field and adult medicine? Same goes with the neurosurgeon. Why do we have? So we need to cater for the pediatrics population. You need to know pediatrics. So so developmental progress of the kid, the physiology, the how the child develop and things like that. So initially I don't want to take a pediatric neurosurgery, but I make peace with my wife. I said, okay, I'll take pediatrics then, because You know, my wife is a pediatrician. When we were in medical school, we were couple at that particular that time. We never had in the same class because we always argue, and then we argue, we get into personal, so we separate the personal and things. So when I finished my neurosurgery, I asked my wife permission, can I join pediatrics? And she said, okay, as long as we don't fight at home. Okay, so that's why I took pediatrics. Yeah. So again, this is work-life balance. So you need to find the family who can accept you.
Okay, Prof. Prof, so next question also regarding pediatric neurosurgery. So what are the common conditions that kids present with neurosurgery, who need neurosurgery?
Okay. Most common thing, hydrocephalus, big heads in pediatrics, and spinal bifida. The child is born with spinal deformities where imagine that the spine, the bone, the spinous process did not form. So it's opened up like this, like V shape. Yeah. And then so the spinal cord attached to the skin and open up. So these are the two common condition in pediatrics. The third one would be tumors in the brain or tumors in the spine. Maybe the child cannot see, maybe the eyes is the cranial nerves is affected, or the child have a sudden weakness. So these are the things that will prompt neurosurgical referral.
I see. So hydrocephalus, tumors, and one more.
Spinal bifida. Deformities.
Spinal bifida. All right, spinal bifida.
So
spinal
three things.
deformities.
Yeah.
Okay.
Yes.
All right. So the next one is they want to know about whether after getting in the master in neurosurgery program, can they choose the subspecialty or does the subspecialty choose you?
Okay, it all depends on where you practice and what is the unit, what does your unit want. So if the unit want to develop as a general neurosurgery, probably you just need to be in general neurosurgery. But in UMC Malaya, we have 7 neurosurgeons. We must compartmentalize. So we give up most of our cases.
Yeah. Okay. I see. So, Prof, this question is the next one. It's not about neurosurgery. I think it's about how can we prepare to specialize in general surgery while waiting for houseman. I guess it's from one of the graduating seniors.
All right. So you have, let's say, for example, you have decided to be a surgeon. Yeah, you like surgery. That's a fact. So you said you want to become surgery. So now, in order for you to get into the surgical program, you need to strategize. So you need to show knowledge, skill, and ability. So if you are intern, you are just graduating before getting the job in as a house officer. It is good if you can do a project, do a research project with any surgeon, just to show your interest, and then you see the how did they work, and perhaps that it will deepen your love into surgery. So again,
I see.
Strategize this. Yeah.
So
there are plenty
explore.
Yes.
Explore, and once you found the person you love, just love it fully and strategize with it.
Yes.
Okay.
Strategize.
And Prof, there's another questions about USMLE. I guess it was asked during when we were talking about the training abroad pathway. Yeah.
All right. If you take USMLE, you are committed to go to United States and practice there. Okay. So I would say with your medical degree, you can pass USMLE. Okay. With your current knowledge, you can pass USMLE or even the UK Medical Licensing Board. So it's a matter of, do you have the means to go to States to complete this? because I think they have 2 or 3 parts. Yeah, you have to sit and then you have to be physically present there to take for the exam. So if you have the means to do that, if you're committed to do it, by all means, go ahead.
All right. Okay.
So far, we don't have any surgeon graduating from US.
Oh, I see.
Okay.
Okay. So, Prof, this is from also our medical students. Is acupuncture commonly used in pain management too?
Yes, but I don't do acupuncture. Yeah, so there are medical doctors who knows how to do acupuncture, but I don't do that.
All right. Thank you, Prof. No, we actually got this just in. We got a reply from the same person Wen Han, who asked us about USMLE just now. So can it be one of the advantages to increase the chance to enroll? I'm
I don't think
thinking
so.
she's talking about a master's
Yes.
program.
No, I don't think it add to the I don't think it has any advantage. Okay, because
I see.
USMLE is the US state. We are previously colonized by UK, so we inherit British system. So we are more familiar with MRCS, yes, but
I
not
see.
USMLE.
Right. Okay. Right. Prof, next question. Will we be using more technology and AI in neurosurgery in the near future? If yes, how should we prepare for it as medical students?
Yes, technology and AI not only in neurosurgery but in all medical field. So anything that can be automated can be delegate, or we can let the machine or AI to do it. So we have to be careful here, because if you are not good, your job will be taken over by AI and Google after this. Yeah, because now you just say a few words to Google, then they can diagnose you. So what's the
Okay.
difference here between Google and a good doctor? So now that's why you need to have knowledge, skill, and ability.
All right, Prof. Since we are talking about good qualities of doctor, I found this question relevant to our discussion now. This is from Adriana. It's our graduating class
Yep.
final year student. So, out of all the good qualities a doctor must have, which quality do you think a neurosurgeon must have?
Whew, I think it should be in general. All doctors must have 3H. The good history, get a good history, have a good hand, and have a good heart. So these 3H are the words of the founding father of medical faculty, Tan Sri T.J. Danaraj. He founded the medical faculty with 3H. He said all students who graduated from University Malaya must have a good history, must have a good hand to examine, and must have a good heart. Okay, so these are good qualities. So I think in every medical field, if you have these 3Hs, then you are all right. Okay, not only in
All right, so
neurosurgery.
3H.
Yes,
3H.
yes.
The hand,
The
the
history,
heart,
get the history.
the history
Get
first, and then the hand for examination, and then the
good hand
heart.
and good heart. That's all.
All right. Good hands
Okay.
and good heart. All right.
Yes.
Prof, third year students asking, what would you say are the most challenging aspects in neurosurgery and how do you overcome it?
Okay. In my particular field is having not able to save the kids. That is to me most challenging things, because especially in pediatrics neurosurgery, because you are dealing with a kid, but you have the trust of the father, the mother, the two great grandmothers, the grandmothers and grandparents. So a lot of expectation on you, and sometimes when you cannot save this kid, it's very painful, and I have lost few kids during my career, and I can remember their names because you grow attached to them. And yeah, so how do I overcome it? I can never overcome this. I usually hide and cry somewhere because it's difficult, because you have invested so many times. You invested the time before surgery, during surgery, after surgery, take all the risks, and when the patient died, especially kids, it's sad. It's yeah.
So that's
you can never.
I'm pretty sure. Yeah, we can never overcome that. It's only just by taking it in and digesting it and
Yeah, you can only
move
learn.
on and learn from that. Is that right?
Yes. You can never overcome this.
Okay, Prof. Thank you for the perspective. It's very, very heartwarming.
Yeah.
Prof, next question is, how is the current accessibility and availability of neuro services in Malaysia? And is there a demand for neurosurgeon actually?
Yes, there are demands for neurosurgery. That's why the program is still running. We want to produce 20 neurosurgeons a year. So the demand is there. However, it all depends on the capacity of our hospitals. Yeah. At this point of time, 1/3 of, or maybe 30 neurosurgeons are in KL. So it's all concentrated here because these are the bigger hospitals. And most of our workforce are in Klang Valley and Negeri Sembilan, so around this area. And so I would say the demand are there. So if you are willing to work in a smaller hospital with a limited facility, you have the chance to develop your own unit. So I would say go ahead if you want this.
But Prof, is that doable as a young neurosurgeon coming up and just say that I want to open up a neurosurgical department, a unit?
Nope. You need at least 5 years of training after you graduate, so that you have sampled all the difficult cases from the spine, from the all sort of things. You have at least seen one, and then you go and venture out.
Sure, but is it possible for a single individual neurosurgeon to start up something? I would say, rather say, I feel it's quite ambitious. Is it doable for a single person to do it?
It's doable.
Like, I have this initiative. Is it doable? Or do I have to wait for, is there some bureaucracy involved? I have to wait for the government, the people in power to...
It's doable. But because there are neurosurgeons out there who work alone in the private sector. So they are able to set up their own service. But then you must select your cases, because you don't want to operate on trauma cases only. Okay? Because main bulk of neurosurgery cases in Malaysia are trauma. Road accident, things like that. So if you are alone, you will be doing trauma only, because you got no time to do the elective cases. Yeah. So usually you need 1 or 2 people to balance things up. Like today you do trauma, tomorrow you do electives and things like that. Yeah.
I see. Okay, Prof, I think that's about it for our the more serious and more formal aspect. But now we would like to also explore a bit on Prof, you have a podcast, is that right?
Yes.
Would you like to speak more about that and spread it out to more people using this opportunity?
All right, the podcast is my experiment, okay? Because I like to do. I am an early adopter, so I like to adopt things and tried it myself first. Podcast is one of my personal project. Initially, I talk about how to study, how to get into neurosurgery, and then I stopped because there are few things that I couldn't find the audience. I don't know what does the audience want. I know how to do it. So it's a working experiment that I have. Then I started podcast Dr. Malaya with my good friends Dr. Nazri and Dr. Raja Rizal. So we talk about anything but not really medicine. So we try to help our medical student to view medicine not as difficult as it is. It is an easy things. If you take things with a pinch of salt, you can pass through this difficult study period. Yeah, and we stopped. The last episode was in March, and then after that we have MCO. We are going to start our podcast again probably next week or next month, because now we can go into studio and we can do podcast. And perhaps if MEDSOC are interested, we can open up the studio for MEDSOC to do some podcasts. We have all the equipment under the faculty, so it is not my equipment; it's the faculty's equipment. So it's okay as long as for education. I have no objection for you to do this. You can come to the studio and do podcasts and learn about editing, learn about how to produce multimedia content. So yeah, during the MCO, I learned a lot of stuff together with the team. Yeah.
All right, Prof. This is from our MEDSOC president. Thank you for the offer.
Sure, no problem. Because we need
Okay.
more community. We need more voice to be heard. Yeah. So
Agreed,
if you can, so we did some experiment with in Dr. Malaya podcast. There's a good platform. You can we can slot you in as our guest, or maybe once a month to be in that program, or twice a week, or even if you are interested, you can do every week. You can interview lecturers on podcasts and things like that.
Nice.
Yeah.
All right.
So
We'll discuss more about that later.
Yeah, you can edit all these and things like that and make it professional. Yeah.
All right. All right, Prof. So for people wanting to interested to subscribe or follow your podcast, what should they do?
Okay. We will relaunch the podcast, Dr. Malaya, in a couple of weeks' time. I will definitely will inform you. At this point of time, you can go to drmalaya.com and find our podcast there. My personal podcast, which is Medicine Malaya, is available on Spotify. If you search under Spotify, you search for Medicine Malaya, then you can listen to my rambling or nonsense rambling. Yeah, that is okay. Yeah.
Okay. So friends, do follow the podcast to get the latest updates from Prof Faizal and also the Dr. Malaya website. All right, Prof. We happen also to know that you are one of the executor in a film that recently got shortlisted for some prize ceremony, the signature.
Okay. Yes.
So, well, why would that come into place? How did that happen?
All right, that is my first venture into serious filmmaking. I love audio visual. because this is how I learn. This is how I study. And the production. So we have a group of people, Dr. Kung, Dr. Prem, and few people in organ donation. We wanted to do a movie and as an awareness project, and we met with a producer who on the way back from Barcelona, and they happen to be Malaysians as well as working in the one of them working in the Faculty of Linguistics. So that's how we strike. That's how we mood the idea of creating a short movie. So I act as the executive producer. I am supposed to have a part in that movie, but because of my schedule was so busy, somebody else have to take over my cast, my
role.
My role. So Dr. Kung is there, and Dr. Prem, and all our nurses in ICU are involved. We did the shooting in the ICU, real ICU, and the exam ward. So it's a good movie. It's a good venture. I learned. I see how people do the proper video and filmmaking.
All right. Thank you, Prof, for sharing, because it's really eye-opening for us medical students in seeing that it's possible to have some, if not true work-life balance, at least some amount of work-life balance, as long as we manage our time properly. And then there is actually a lot more to life outside of the hospital and the wards.
So you just need to know yourself. You know your personality. What can you do? What you cannot do? What is your strength? And then use that strength to amplify what you have. And I said that I always tell my medical student that studying medicine is very easy, because it is easy. Practicing medicine is difficult. Study medicine is relatively easy, but practicing is very difficult. Because you have learned how to do this. You have learned how to do how to learn when you're since from your early years. You know how to learn, and you think that we think that learning medicine is difficult, but it is not. You just use the same method that you have learned so far and amplified it. Use it. Take for example, if you want to, I'm pretty sure all of you have some skills. Maybe playing games, maybe swimming, maybe riding a bicycle. You know how to do that, and you use that experience in medicine. Take for example, Chee Yang, what skill do you have? What do you know?
I play some basketball. I play some computer games.
Okay, let's take basketball.
Very little instruments.
It's okay. Let's take basketball. Okay.
All right. Okay.
So when you train for basketball, when you are in secondary school, or even in college, do you practice as playing a game of basketball for the full 4 quarters? No,
Not
right?
Really.
So what do you do? You do a set.
We break down the game into pieces, and then we train that piece, perfect that piece.
Yep. So you do drills, you do dribblings, you shoot 1 point or 3 points, and then you try to shoot until you get the muscle memory. So, and then you play games. So now when you go back, when you go to the ward, what do? You do skills, you do drills, you do chest examination, for example. You do inspection, palpation, percussion,
auscultate.
So you do skill set. You only play games during exams. That is your real game. That is the
Okay.
1-to-1, okay, or 3-to-3 and things like that, okay. But during the
Okay.
training, you do all the sets until it becomes perfect. Then you're ready to go for the exam. So you have to learn how
Makes
to
sense.
do
Okay.
this in your basketball. Why can't you bring it into medicine? You can do it.
All right. Thank you, Prof. I will try to move that concept into my medical training. Prof, just very final part of our session today. Any advice to medical student who's interested in neurosurgery, or just advice to medical student generally?
Okay. My general advice is number one, you know how to study already. You already know how to do it. Bring that back into medicine because medicine is easy. Okay. Now, once you pass, you must set a goal of what you want to be. Okay. And you tailor this goal to yourself as well as your family. Okay. And what skill and how do you study the best? If you like to meet people, if you like to talk to people, then use that skill into your medical specialty. Okay. If you like, for example, a computer, and you harness that knowledge to create a new program or apps in future for in AI and things like that. Yeah. So that is how you achieve work-life balance. Do what you love doing. I would say is the best motto. And
All right.
sometimes you choose your path, but most of the time the path will choose you. Okay, you probably try to become an orthopedic surgeon, but maybe ENT is actually calling you, so you're posted to ENTs, and you yeah. So don't worry. Okay.
All right.
Right.
So from Prof Faizal's words, Prof advises to take the time to know ourselves, know our niches, our strengths, our weaknesses, what we like, and to and yeah. So that's it from Prof Faizal, I think.
Yep.
Anything else, Prof? If not, then I think we are short on time already, and we
Okay.
can close today's session. All
Right.
right. Okay. So
I hope to
I'd like
see
to.
all of you in clinical practice and start learning how to become a medical student and be a good doctor. Okay, I think all of you must have missed the clinical work. Okay, because you don't feel like a medical student studying at home. So we would like to see all of you back in the faculty.
All right. Thank you so much, Prof. I would like to also again take the opportunity representing Medical Society of UM to thank Prof. Faisal for being with us today, sharing experiences, stories, and also perspectives. All right. So thank you guys for tuning in once again. Thanks. So we'll have a feedback form out soon, and please first so we know how to improve for the next coming sessions. And again, this is a series, so there'll be more episodes coming with more specialists, mainly specialists from UMMC. And also just like our page and feel free to share this video, and this video will be posted on our wall soon. All right, so a lot of thank you, Prof, coming in for you, Prof.
All
All
right,
right,
thank you.
okay, thank you, everyone. Thank you, everyone.